Hi everyone, I'm Dr. Ashley Ross. This is Dr. Hiten Patel. We're both faculty here at the Northwestern Feinberg School of Medicine in the Urology department. This is Prostate Cancer Awareness Month, and so for this segment we wanted to talk a little bit about some frequently asked questions and sort of give answers to those questions. Both Dr. Patel and I are specialists in prostate cancer, and we're really glad that you came to this video. It's a great question. I'll fill this one first. The prostate cancer is a highly prevalent disease, and it can affect men at all ages. There is an increased incidence and prevalence of prostate cancer as you age, but many young men can be affected. Screening might be recommended to start by some institutions in your mid-40s. And I think that's appropriate because the average age of the people that we treat with localized prostate cancer is close to 60, with many men being in their mid-40s, early 50s that have prostate cancer and even aggressive disease.
Yeah. I would agree with that and just say that there are some men, in their 40s, 50s that we will diagnose and have clinically significant disease, and often your kind of window of intervention is a little bit higher with earlier diagnosis. And so, what we look for is more of your PSA for age kind of correlation to see if that would indicate that you'd be at higher risk than the average man.
And I think there's two things. The one is, if people have a family history that's strong, even not just prostate, but breast, ovarian cancer, we sometimes think of genetics that can drive this. That can be a reason to get prostate cancer screening younger. And the second thing, and this goes hand in hand, sometimes when young men are diagnosed with prostate cancer, if they have low risk disease, there was the question of, can I follow this? I'm so young. At least my thoughts are, yes, certainly. So if you're a candidate for active surveillance, just because you're a young gentleman doesn't mean that you can't monitor the cancer until it needs treatment. I'm not sure about your thoughts there.
Yeah, I agree. And I think we have enough tools now to say, well, is this really a low-grade cancer? Is this something where we're missing higher-grade cancer that we just hadn't detected? And so I think we're better at that. And for that reason, I'm more comfortable following younger men who have low-grade disease. Yeah, so I think PSA is a marker or a screening test, but it's not perfect. And what we often look at is your PSA per volume of prostate. And so if we normalize it to a man's volume of their prostate, there can be some men who have higher levels either because of inflammation or just having a larger prostate size. But after we normalize that to their age and prostate size, usually that gives us a better idea. So just having high PSA doesn't mean you have prostate cancer, but it means that you may need potentially further diagnostics or at least consultation to talk or think about it.
Yeah, that's a great question. Just like Dr. Patel mentioned, as your prostate gets larger, you'll make more PSA. Sometimes that will trigger a alert to see a urologist, and because there's more men coming in to see urologists, there might be more men going towards prostate biopsy and then being diagnosed with prostate cancer. If we look at clinically significant prostate cancer or prostate cancer that needs treatment, there is not a correlation between prostate size and prostate cancer that's ever been firmly established. If anything, if we had to really push the data, it would probably be an inverse correlation where larger prostates might be somewhat protective. But I would say no correlation. It's just a statistical abnormality. That's sort of my thought about it.
Yeah, I agree. And I think that's where the PSA density kind of comes into the mix, where for the same level of PSA, a larger prostate actually has a lower risk of heartburn prostate cancer.
It's a great question. No is the short answer, and actually there was a study. There's some caveats to these retrospective registry studies that showed that among the different things that are protective for prostate cancer, multiple ejaculations per month seem to be protective. The number was pretty high. It was like 21 ejaculations per month to have like a protective effect. We also have to think about other things that are protective against having prostate cancer. Those are, in my opinion, when I look at the literature, keeping a lean, body weight, and I would say avoidance of charred red meats. That when you char red meats or char fats, you can sometimes release a carcinogen called FIP. There's some data around lycopenes and tomato consumption, green leafy vegetable consumption. that can help with that. There's some data around getting vitamin D, as in David, and that's the one vitamin I would say that has borne out. It doesn't really matter how much of it you take. You can't take too much of it. But that all said, the recommended daily dosage is like 500 international units is enough with a little bit of sunlight exposure. There's some mixed data, but it seems to be protective. American College of Sports Medicine says 5 days a week of some kind of physical activity seems to be protective. And then more kind of emerging data about dyslipidemia and people who can have better control over their lipids, better control over their and then from metabolic side of their diabetes, and certain drugs that control them for the populations that have those afflictions that can be protective. And the last thing I can think of is potentially aspirin, but that's a very controversial area.
Yeah, I agree. I think in general, some of these relationships are for all cancers, not just prostate cancer. So some of the healthy eating vegetables and physical activity. I think cruciferous vegetables, broccoli, those kind of things, that sulforaphane in it, those have been proven across all cancers. But some of those other things are more a little bit prostate cancer specific. And generally good to do.
And then certainly for sex, a lot of my patients, besides asking like, hey, did I get this from too much sex? And the answer is probably no, because actually more ejaculates are protective. Some of my patients will ask me once they're diagnosed, can I transmit this to my partner by sex? And the answer again for that is no.
Yeah, and I think there's a few studies that definitely, the greater ejaculation is correlated with potentially low risk, but we don't know if that's because men are maybe seeing urologists, or this is a different subset of, patients that may be getting more screening or something like that may account for it, but if anything, protective. So I'd say the short answer is no. There are very few studies, some that say maybe on the order of 3 out of 1,000 men, maybe slightly increased risk, but I think, again, these are men who are probably seeing urologists because in order to have a vasectomy, you would have seen a urologist who may have closer healthcare follow-up. So you may get a higher diagnosis just because those men are potentially being seen and screened better. But the vasectomy itself is not known to cause increased risk of prostate cancer.